From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Ciara Speller. Members of the Holyoke Soldiers Home Coalition have created a new organization with a new name, mission, and focus, the Veterans Advocacy Coalition. The new coalition has more than 25 members and includes former leaders of the previous coalition, including our two guests today, both of whom have served as administrators at the Holyoke Soldiers Home. Paul Barabani is a former superintendent and John Parody is a former deputy superintendent. Both of our guests came out of retirement to help mitigate the COVID-19 crisis at the Soldiers Home in March of 2020, when 77 residents died during those early days of the pandemic. They were honored by the veterans of foreign wars with the Above and Beyond Award earlier this year. And we thank you both for being here with us today.
It's great to be here. Thank you.
So we want to just jump right into these questions, right? Paul or John, whoever wants to answer, why was it formed and who was on this coalition, as well as a mission and end goals?
Sure. So we came together as a coalition, originally as the Holyoke Soldiers Home Coalition in April of 2020. And that was really at a time when we as a community were learning about the devastating loss of so many veterans at the Soldiers Home in Holyoke, and outpouring of concern that we were receiving. And we had received some calls from the local veteran community, and they asked us, what could we do? What can we do to support the family members? What can we do to take some action? And the original idea was, we're going to do some kind of event in the community. We're going to perhaps do a monument, memorialize the veterans. And I'd written a column that was in the Daily Hampshire Gazette about what could have been for the Soldiers Home in Holyoke, with a vision, a plan that Paul Barabani had for a new wing at the Soldiers Home. This was in the 2011 timeframe that would have had 120 beds, private rooms, private bath. And as we now know, the state didn't act on those plans and what could have been with that new building. So we said, the best, most purposeful way for us to honor the memory of those veterans who died and to prevent a tragedy like this from ever happening again is to build a new Soldiers Home in Holyoke and to advocate for reform. So that's the past 2 years of action, which culminated in legislation this past summer that the governor signed. And we could have stood down at that point, but all of us felt this commitment that we worked so well together in our advocacy that what now could we do to help improve the lives of our veterans in our state. So we became the Veterans Advocacy Coalition.
And unfortunately, it took, a national disaster to get state and federal officials to take action both in Holyoke and at the Chelsea homes, right? So what are some of the things that you achieved with that coalition?
I think that a quote that I came up with from Martin Luther King says, "Our lives begin to end when we become silent about things that matter." And we couldn't remain silent. We had family members of the veterans that were lost. We had family members of veterans who still reside at the home, former staff, knowing what they had been through. We couldn't remain silent. And I think one of the first things we did was try to assist the home, supplement their assets. And we had a nurse who was familiar with infection control, who lost her uncle, 101-year-old Tony King, and she was very close to him. And we had seen in a New Hampshire nursing state veterans home that had 0 losses, and they attributed to a robot, a mechanical robot that had ultraviolet capabilities that would really attack and eliminate any of the pathogens. So she picked up that and went and found vendors, funding sources, and tried to meet with the home to help them acquire something that was going to help them immediately. So this wasn't our long-term goal of the home. This was something to help them operationally right at the beginning of the COVID. But then later on, we moved on. Again, John and I had been there. I'd been there for nearly 5 years, and knew the building and knew the veterans and know the staff and the conditions. But we didn't want to get involved initially to be gawkers, but we said that now with the question of the future of the home being in Holyoke, we needed to get involved, and so we did. And so we were able to meet, and I think we had some respect because the design team from Payette, who designed Chelsea, welcomed our input into what the new home should be. And we actually had Zoom conferences and pretty detailed briefings. So our concept was small house or greenhouse, which is the new concept in long-term care, and it's not just building a building, it's a philosophy of care to ensure private rooms with showers, to ensure the dental suite is carried over, because dental care is so important to everybody's health, but especially in the elderly community, and also that we felt that adult day health care was essential. So those were the main things that we wanted to accomplish, and it really came down to a question over the number of beds, and I think that it was truly through the work of the coalition that we actually influenced the actual number of beds that were there by about 50 beds.
Yeah, and so do you feel that the State and Veterans Administration listened to you and made any efforts to improve conditions?
Yeah, I think demonstrably, the success that we had in building a coalition and in working with our elected officials and our legislators to really reimagine a new soldiers' home in Holyoke, and to embrace some cultural changes in how the soldiers' home is run and led. All those things came about because of the active involvement of members of our coalition and the work that we did. So it's in that spirit that we want to continue the work that we did. There's so many issues that our veteran community sees each and every day that we think that we have a team now, we work well together, and we can now achieve some good success with some other initiatives in our veteran community.
All right, Paul and John, thank you so much. And we'll continue our conversation when we return. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about the newly formed Veterans Advocacy Coalition with members of the coalition, Paul Barabani and John Parody. So we want to ask, what is the current situation at the Soldiers' Home in Holyoke right now as far as staffing and patient health and safety measures?
Well, I visit the Soldiers' Home on a regular basis, was up there last Thursday, and over a period of months have seen improvement in veteran participation in social events. We've come a long way in the last 4 or 5 months. But the concern that I have for the veteran community is that right now their capacity is 111 beds. When John and I were there, 2016, we had 265 veteran beds. That's a significant, it's about 42% of what we had before. So veterans in the community are suffering because of a lack of bed care available, at the Soldiers' Home. And when we were there, we had a 2-year wait list. So I can't imagine, what it would be at this time. So that's one concern: is there a possibility of increasing the number of beds so that we can better serve the veteran community? Because it's going to be 4 to 5 years before we see a new home. And the second thing is that, yes, while we've got approval to build a new home, the question becomes, are we going to adapt the culture change to this greenhouse, which is a small house concept where we live in a pod with 12 residents in 2 universal workers called a Shabazz, which is a CNA with 128 hours more care. There's no training program for that in this state. And we need to I would suggest to work with Holyoke Community College to create a training program so we can, in fact, fully implement the small house concept.
And so you're advocating for a person-directed care model and looking to create a national model. So what would that look like?
So person-directed care. Typical years ago, when we started at the Soldiers' Home, institution-directed. When you got up in the morning was based upon shift change of staff. When you ate in the morning was, well, when the kitchen could put out. So you're getting up when you don't want to. If you're being forced to get dressed, you're eating what they serve you. The new care would be you decide when you want to get up. And when you get up, right in your home, you can say, I'll get up at 9:30 and I want 2 eggs over easy with some toast and I'll have coffee with that. And the Shabazz will make that for you. Isn't that a wonderful thing? I mean, think about the thing to be able to determine, but beyond determining those things, we're also determining, your course of your care and treatment. There are a number of people that were on diets because there was a fear of choking, and so their food would be pureed, right? So I like roast beef. Well, good. You'll have your roast beef, but it'll come in a liquid form. The person can say, no, I want to have it, and I'll take the risk. I want to chew that and taste that and feel that. And so the person, the resident themselves, makes decisions that affects their care and how they treat and how they live within that environment. That's a huge cultural change for healthcare industry, and we hope that the state can do that. And
what about building and an opening date? What about that?
We're hearing the anticipation is that this coming summer they'll be breaking ground, and this next year is going to see a lot of changes. One of the reasons why we felt it was so important to look at the advocacy and keeping our core group together is we got a new governor coming in, a new administration, new legislators, and we want to make sure that the things that we're talking about today are a priority, that the governor comes out and visits Holyoke. She sees the facility, she sees the plans, that things that Paul just mentioned about the staffing, how are we going to plan? This is going to take some significant strategic planning. And most importantly for us is how are we communicating the progress, right? So, anticipating that's a summer time frame, they're going to be breaking ground, perhaps 3 to 5 years for that building. The time is now to start planning for that cultural change that Paul's talked about. We know that the healthcare outcomes are improved with this transformation. There's cost efficiencies that are involved with going to a small house design using greenhouse principles. It's a national trend. The federal government is looking at funding facilities across our country. This is a great time. It's exciting for us to really enter this new year with these prospects. I think you get better health outcomes for the resident and a greater sense of satisfaction and commitment from the staff to be able to do that. But it's going to take a universal person. That person is going to be providing care with the veterans. They're going to be doing housekeeping. They're going to be preparing meals and doing laundry. And so it's like they're home. But that's going to take bit changes in the silos that existed with housekeeping department and dietary department. There's going to be some changes, and that's what we want to adapt to that now.
And John, I just want to ask you, going off of what you said, which local, state, and federal legislators have helped you in your mission, and also what types of legislation are you looking to get passed?
Yeah, we really think the legislative affairs has been our strong suit. We've had some extremely productive discussions and dialogue. I got to say, Senator John Velas from Westfield has really been a champion for these reforms and for all the things that we've asked for. Truly, one of the first things we mentioned to him is that he needed to sit down and really listen, take the time and listen to the family members at the Soldiers Home in Holyoke to really understand the complexity of what they've gone through and to really hear from them all the problems they've had. And he did that. He took the time and had listening sessions with family members, and it was hard. It was really hard for all of us as a community to hear what they had gone through. But we needed to start there. We couldn't identify, you couldn't make progress forward until we made that crucial step to really listen. And the family members really respected him for that. And we've built upon that relationship. So, in our mind, the essence of this coalition is that it's bottom up, not top down. It's really listening to the community. It's listening to us as veterans. Congressman Neal has been exceptional right from the very beginning. What do you need? And the fact that we have this coalition now, just this past year as just one example, when there was talk about potentially closing the VA, the U.S. Department of Veterans Affairs Medical Center in Leeds, in Northampton, and making shifts to more community care in the community for us as veterans. And we said, no, that cannot happen. We were able to work very closely with Congressman McGovern's office. Our coalition came together. We worked with the Massachusetts Nurse Association. We had a town hall in the village of Florence, where we had standing room only. It was we provided public testimony in a congressional hearing kind of format with Congressman McGovern. He took that information and he called Secretary McDonough at the VA in Washington and said, I just listened to the veterans in my district, and they tell me this will have devastating consequences for their health and well-being. And the VA withdrew those plans. That's the essence of why this coalition is so important, the work that we can do.
Yeah. Thank you so much for your insight. We appreciate it. So what does the future hold for the Holyoke Soldiers Home? We're going to have that discussion when we return from the break. You're watching 22 News in Focus. You're watching 22 News in Focus, and today we're talking about a newly formed coalition looking to provide support and guidance concerning issues at the Soldiers Home in Holyoke and other Veterans Affairs. The newly formed Veterans Advocacy Coalition will be working on other issues in the future beyond the two state soldiers' homes in Holyoke and Chelsea. So we want to start by asking, what are the other concerns that the coalition will be addressing?
Yeah, so I think the best way to explain it is we're always going to be looking at access for our veterans, access to care and access to their benefits. So we know that about 50% of veterans don't use VA health care in our region. So there needs to be some education for those providers that are seeing veterans outside the VA system. Paul talked about the importance of dental care, dental benefits for our veterans. Changing demographics. Our Vietnam veterans are getting of an age where they need long-term care. The post 9/11 veterans are right behind them, and making sure that the support and services are available for them. Our women veterans, the fastest growing population in our U.S. military, 1 in 3 tell their VA healthcare providers that they have military sexual trauma. That is unacceptable as far as the state needing to identify resources for them. A state audit said that only 6% of veterans who are women have been identified. So we need to do better by our women veterans. So that's an area that we're going to concentrate on. And finally, support for the veteran service officers who are, in my mind, the boots on the ground in their cities and towns, our municipalities, and how they provide services for our veterans. There's inequities in how those programs and services are delivered to veterans. Some towns have a full-time person. Some towns, in some cases, have vacancies where veterans go to other communities for programs and services. We got to do better by that. In many cases, our veteran service officers in our municipalities don't make a livable wage. There's a lot of turnover. We have to pay them a salary where they can raise families and stay in Western Massachusetts, stay in the communities where they grew up and were raised. And so all those things, there's a lot that we'll be focusing on in the next year as far as other activities, while keeping an eye on the Soldiers Home in Holyoke, the sister facility in Chelsea. So a lot of activity in next year.
Yeah, and just quickly, you mentioned women veterans. Are you able to talk about how many beds are available right now to women?
Sure. So there's a small number of beds in Holyoke. I know that'll be a big part of the new design. What I think is important to recognize is that population is growing. They serve in every specialty in our armed forces. The number is increasing. So the new Soldiers Home in Holyoke needs to take in consideration that we have enough beds, private beds, and we have the programs necessary to provide that kind of support for our women veterans.
Yeah, and I think that there's no set number of beds that would say these are reserved for women. As the admissions are made, now with all private room, it makes it a lot easier than it was when we were there and we had multiple occupants in a room. So I was up there the other day, I saw maybe 2 women, and the percent that was serving at the time that are needing long-term care now was remarkably lower than it is going to be in the future.
That's right. That's right.
Yeah, and so we were also talking about what veterans can do to make a difference, right?
Well, I think you came home from the service and took off the uniform, but that doesn't mean you need to stop serving. I think that they need to become involved to make a difference, and they can become volunteers. They can volunteer at the Soldiers Home. And I know my brother goes up there, and he's president of Chapter 111 of the Vietnam Vets, and he goes up there every Monday, and he's got a list of 4 or 5 people that he goes and visits and sits down and tries to develop a relationship and make the person feel good. But he goes one day a week, and has 5 people. Well, there's 111 residents up there. So the more people we have that are going to be involved in visiting and establishing relations and making those years of that could be isolation to be more social and people who could be accepting of what their situation is, I think would be great. And if there's other volunteer programs, the Agawam Cemetery, I'm involved with the cemetery, but if there are veterans that want to be part of a firing detail or with the chapel services, Veteran Support Center in Agawam. There's just so many veteran opportunities. They could reach out to us and use our email to reach out and say, here are my skills. Where do you think I could help? Come on back and help.
Yeah, our coalition has representatives from the major veteran service organizations. We have municipal, city, and town veteran service directors. We have family members that had loved ones at the Soldiers Home. We have a great cross-section of the veterans community. So if there's a problem out there or some barrier, we can help steer them in the right direction, and also identify issues that need to be looked at for our legislators. So we're really excited about this new effort that we're going to have.
And how can our viewers learn more about your new
Sure.
coalition?
So you can write to us at Vets Advocacy Coalition at Gmail. We're also on Facebook. We got more than 1,000 followers. On any given day, we can reach out to 30,000 veterans across our state. So we have the immediate way of disseminating information, getting information out there. If you write to us, express your interest. It's a roll up your sleeves kind of coalition, though. There's an expectation that if you join us, that we're going to put you to work. So that's a big part of what we do.
Yeah. All right. Thank you. And we'll have some final words when we return. You're watching 22 News in Focus. You've been watching 22 News in Focus, and today we've been talking about the newly formed Veterans Advocacy Coalition with members of the coalition, Paul Barabani and John Parody. We thank you both for being here on our show and providing your insight. Really appreciate it. And for all of our viewers at home, we thank you for watching. If you missed any of this episode, you'll be able to find it on our website at wwlp.com. From all of us here at 22 News, have a great day.